Who is with you when you give birth will shape how your motherhood begins. Welcome to Natality. I'm a perinatal psychotherapist and I work with what happens in the mind when you are becoming a mother. In the last two episodes, I talked about how emotions and the brain together shape the conditions for birth and why what happens in the delivery room stays with a woman long after she leaves the hospital. Today, I want to talk about presence, about who is with you during birth and why who that person is and whether you know them matters in ways that are not immediately obvious. Imagine you're in the most intense moment of your life. You're deep inside yourself, inside your body, in that primal rhythm, that trance-like state I talked about earlier. And at that moment, someone new walks into the room. Someone you do not know. Someone who then needs to introduce themselves, explain who they are, assess the situation. What does your brain do in that moment? Well, it orients, it evaluates, it starts thinking. And that is exactly when you need it least. It steps out from birthing consciousness. What the research tells us? Let's start with what we know. The evidence on the importance of companionship during birth is substantial and solid. The Cochrane Group is one of the most trusted institutions in the world when it comes to synthesizing medical research. Their systematic reviews are considered the gold standard because they do not rely on a simple study. They analyze thousands at once with rigorous quality assessment. So, Cochrane looked at the results of 26 studies conducted in 17 countries involving over 50,000 women. What they found? Women who had continuous support during labor gave birth vaginally more often. They were also less likely to need a cesarean section or instrumental delivery. They were less likely to reach for pain relief, and they had shorter labors. And they were more satisfied with the overall experience. And guess what? No negative effects of having a birth companions were found. But who was actually considered a birth companion in these studies? Well, that question matters more than it might seem, and I want to look at it. Across the different studies, companions included partners, mothers, friends, doulas, and midwives, and Cochrane analyzed them all together. So, to understand whether the type of companion matters, a different study was needed. And that study came. Jayasundra and team made a meta-analysis of 35 randomized controlled trials published in PLOS ONE in 2024, and they were first to look at this question so comprehensively. The researchers examined two key dimensions: whether the birth companion was familiar to the woman or not, and whether they were trained in birth support or not. The results are clear on one important point. Familiar companions were more effective at reducing fear and anxiety during labor than unfamiliar ones. Well, relationship and trust just matter, and not just emotionally. you can see that it matters physiologically. The authors themselves acknowledge that it is difficult to identify single best companion because different companions offer different things and different studies show us different outcomes. But the pattern is readable. A partner or close family member offers something no one else can replace. It's the sense of safety, which is rooted in an existing attachment relationship. At the same time, a partner is often frightened themselves. They need support too. Well, more on that in upcoming episodes. But what about doula? A doula, someone trained in birth support outside the medical system and outside the woman's social circle, offers something different, also valuable. The calm of someone who has been present at many births, the knowledge without bringing their own fear into the room. A presence that is not emotionally burdened, but by what is happening in that delivery room. And how about a known midwife? A known midwife brings both professional medical competence and relationship. This does not come directly from the Jayasundra study, so it emerges from a separate body of research on continuity of care, which I will come to in a moment. This is a Swedish study from 2025 which showed that women's interest in having a midwife they already know present during birth has grown significantly. The need is felt most strongly by first-time mothers and women with a fear of birth. Perhaps this is exactly that heightened perinatal intuition I talked about in the last episode, proving itself right. But there is another dimension that research is increasingly confirming, and one I consider crucial, and that is continuity. So, not just the presence of the same person during birth, but a relationship that begins before birth and continues into the postnatal period. Cochrane published an update of their review of midwifery continuity of care models in 2024, covering pregnancy, birth, and the postnatal period. And women who experienced continuity of care reported more positive experiences across all three phases. Lower rates of cesarean sections and instrumental deliveries were also recorded. So the authors emphasized that these benefits are linked to relational continuity. When the same midwife or a small team accompanies a woman through pregnancy, birth, and the postnatal period. This is supported by Swedish study from Karolinska Institute, published in 2024, the first of its kind in the Swedish healthcare context. Women receiving continuity of care were less likely to need medical interventions and less likely to experience adverse pregnancy outcomes, with no increase in risk of complications. And what about what happens after birth? Well, a systematic review from 2023 found that continuity of midwifery care leads to a reduction in anxiety and depression across the entire perinatal period. And these findings are not only about birth, they're about what shapes the quality of a woman's life, her relationship with her partner and with her baby. So what all of this means? Medical expertise in birth is invaluable, and there is no room for romanticizing here. It saves lives when it needs to. That is our cultural and civilizational heritage. But research is showing clearly that there are factors that used to be called soft and for which we now have very hard evidence. That is relationship, that is continuity, that is presence of someone trusted, a sense of safety. Care systems differ across countries and there is no single right model. Some changes happen from the top down, through health policy and systematic decisions. Others from the ground up, through women's awareness and the choices they make. But the important thing is that birth reveals the essence of what matters most to us as human beings. And that is who is with you and how prepared they are for that. Not only in terms of medical skill, but in their capacity to be present, to be in relationship, in connection, in contact, the very thing that creates the conditions for a child to be born and also for a mother to be born. What this gives psychologically? Let us come back to what I talked about earlier, to the state of birthing consciousness. When someone you know is with you, someone you can trust, someone you have built a relationship with before birth, you can stay in that state, the state of birthing consciousness. You do not need to figure out who just walked into the room. You do not need to assess whether this person is safe. You do not need to activate analytical thinking at that very moment when the whole point is just to let it be still. But there is something more, something deeper than the cause of the birth itself. When you build a relationship over the course of your pregnancy, throughout repeated meetings, throughout conversations, that goes beyond test results and blood pressure. Something important begins in you. Gradually, in contact with someone who is genuinely present and in dialogue with you, you start to feel more like a subject in your own experience. You attune to what your body and your mind need. And not because someone is telling you how to feel, but because there is space for you to discover it yourself. A relationship that makes room for your inner world makes it easier to attune to what birth will ask of you. Meropi Michaleli, a perinatal psychoanalyst from Athens, who has spent over 25 years working with parents and newborns and training perinatal teams in a psychoanalytic approach, speaks of the transition to parenthood as co-creation, one in which parents, the newborn, and the perinatal team participate together. And that interrupting the intergenerational transmission of trauma becomes possible precisely through introducing a new way of relating with perinatal professionals. So you just learn something new, deeply. That's exactly it. An experienced person accompanying a birth, someone who is attuned, calm, present, can co-create a good relational pattern. Not just be there physically, but support the activation of what we might call a good internal objects. Those object those memories in us that remember what it feels like to be cared for. And a woman who has experienced that kind of presence during birth enters her first relationship with her child carrying something in herself that is ready for the meeting. She has more space. She does not have to spend energy processing a wound. She can simply be with her baby. And there is one more dimension to this. A woman who throughout her pregnancy has been a subject in a relationship, not just a patient coming to be told what to do, enters motherhood with a greater sense of agency. She feels that something depends on her, that her voice matters, that she has learned to trust her own intuition. And one of the hardest experiences of early motherhood, that sudden leap from depending on others to full responsibility for a new life, is smaller. She does not start from nothing. She already carries something that knows deep inside. And there is space in this for father too. When care is continuous and relational, there is a greater chance that he will be invited into the process as well, that he will have the opportunity to build his own inner representations of the baby, of himself as a father, of his partner as a mother. So let us bring together what increases the likelihood of a good birth experience. The first thing is the presence of someone who knows you, your fears, your needs, what matters to you. The second thing is the relationship built before birth with a midwife, a doula, or another birth companion, so that when you're in that delivery room, there are no strangers. The third thing is care that is continuous through pregnancy, birth, and the postnatal period, and feeling that you are treated as a person, not a case to be managed. And maybe fourth, something that I see in my work, the feeling that something in this process depends on you, that your voice matters, that your body knows. So in the next episode, more on the psychological dimensions of how and why the birth experience becomes part of your reorganizing identity. That's all for today. See you next time.